of Lens for Life, and I'm also the chair of the Oregon Coalition for Responsible Use of Meds. I'm honored to be here today with the governor and the other guests. 220 million pills. Every year in Oregon, we prescribe 220 million opioid pills. And the results of this has been devastating. We've lost thousands of lives over the last 10 years in Oregon. Nationally, we've lost well over 100,000 lives. The lives are just the tip of the iceberg. We will not meet this challenge until we finally treat substance use disorder and addiction the way we treat other chronic conditions, so that just as someone who goes to the hospital because their insulin levels are off with their diabetes, and we treat that person and we welcome them, we need to have the same approach to addiction. Instead of saying, sorry, we don't have room, can you come back next Wednesday or next week or the next month even? The biggest hurdle to getting there, I think, is the wall of stigma around addiction. Mm-hmm. We are honored today to be joined by the family members of Jordan, Max, Jason, and Jim, who died to opioid addiction, and whose parents, whose moms who are here, and other family members had that unthinkable moment where they learned what had happened, and they've taken that moment and decided to turn that tragedy into something meaningful for others. These are our main advocates in the effort to tear down that wall of stigma. We are here to celebrate a happy day in the signing of this legislation, which will go to great lengths to help us marshal in the challenge of opioid addiction. Governor, I'll note that in your tenure, with the help of bipartisan legislators and with very effective efforts from Oregon Health Authority and partners, we've seen, I think it's a 21% reduction in opioid prescribing since you took office.
That's
I think
great.
that's right, McElveen, right?
That's great.
We are pleased to be here and say thank you for your efforts in leadership. I think some of the moms maybe wanted to say hello, if that's okay. Julia, would you like to go first? Okay. Julia Pinsky, mom of Max.
Thank you. We just wanted to say we really appreciate your dedication to this area that is so often shied away from, and we're really encouraged, I know we all are, by the new task force looking to more legislative action, to the many, many areas that can change how we save lives in the state. So thank you.
Thank you.
Jackie?
Thank you.
Mom of Jim.
Jim Jones is my son, my only child. So I definitely thank you and everyone that was involved in making this hospital happen, so that other mothers like us don't have to understand what we're going through with the grief. So thank you.
Carrie, mom of Jordan.
Carrie Strickland, mother of Jordan. I just really want to thank you for your advocacy and your work. We have lots left to do, but we're moving in the right direction. And for all of us moms who have lost children and thousands of others like us, to know that our children's lives mattered and that we are going to make big change. So I appreciate your work.
Thank you, Carrie. Kristen, do you want to say something? Kristen, mom of Jason.
I just want to thank you for all you've done. It does mean a lot to all of us.
So, as many of you know, when parts of this legislation were stuck, these moms wrote a very well-timed opinion piece for the Oregonian, which had a great deal to do with dislodging some of the key provisions of this legislation. So, on behalf of all Oregonians, I want to say thanks to you all for making such meaning out of something so tragic. Thank you very, very much.
Thank you, Dwight. Thank you for your leadership, and to our moms and to our families that have been so devastated by this scourge. Thank you for your visionary leadership. Thank you for your willingness to speak out, and please know that we are holding you in our hearts. I am really proud to be signing House Bill 3440 today. It's critically important to support Oregonians at their most vulnerable moments, and it provides essential tools to battle the opioid epidemic. I had a number of legislative colleagues who worked very hard on this legislation. Some of them are here, some of them are not. I'll thank those that are here. Representative Brock Smith, Representative Sherry Malmstrom, and Representative Mark Meek. Let's give them a round of applause. And then in absentia, I'd like to thank Senator Steiner Hayward, Representative Williamson, Representative Bueller, Representative Greenlick, Representative Hernandez, Representative Kennemer, and then I got everyone else. And it looks like we've got some students coming in. Do you guys want to come in and join us? It's totally fine.
Come on in, guys.
Come on in. Come on in.
Plenty of room.
So with the bill that I am ceremonial signing today, I'm going to be signing for the young people coming in House Bill 3440. With this bill, Oregonians are going to have better access to life-saving overdose medication, and it will also prohibit insurance companies from delaying access to much-needed treatment for those who are suffering. In addition, the bill allows Oregonians to begin the journey to recovery with better access to our drug courts. We know that these meaningful interventions, not incarceration, will help lead to healthier outcomes throughout our state. While we're certainly celebrating the signing of this legislation, I think it's also very important that we not stop here and that we continue our efforts to tackle this epidemic. Across the state of Oregon, the opioid crisis is tearing our families apart. It is ravaging both urban and rural communities. It prevents many Oregonians from leading productive lives and achieving their full potential. It is going to take the efforts of all three branches of government, our state agencies, our advocates, and our families to prevent Oregonians from becoming future victims of opioid abuse. And that's why I'm very pleased to have assembled a task force on opioid abuse and dependency. We have 15 committed Oregonians who are serving on the task force, some of whom are here with us today. They are legislators and medical experts and drug treatment specialists who are going to convene this afternoon. I've charged the task force with identifying efforts that will break down barriers to treatment and improve public health across our entire state, including a statewide drug take-back program. It is my expectation that the task force will recommend meaningful legislation for the 2018 legislative session. I believe that we need to use every single tool in the toolbox to help treat the individuals and heal our communities and our families impacted by opioid abuse. We cannot forget the parents, the friends, and our neighbors suffering from these devastating impacts. I just want to again say my thank you to the moms who shared their stories and took time out of their schedules. Again, please know that we are holding you in our hearts and appreciate your work to ensure that other families don't have to go through this again. So, thank you. So, I'm going to go ahead and sign the legislation. So, you guys are going to have to get closer so we can get you all in the photo. And then we've got students here. Where are you from? Ben Middle School. Okay, all right. Have you ever been at a bill signing before? Okay, well, this is a ceremonial bill signing. I think I missed one pen. Here we go. Keep it back. All right. I'm expecting your help on the task force, and I know you've got your help on the task force, so thank you, thank you, thank you. And I know I've got your help on the task force, okay, all right. Thank you all, I think we're done. So I'll save some pens for some of the legislators.